using it. Good morning, everyone. Well, I'm not sure exactly whether it's morning on your side of the aisle, but it's morning here. It's 9 o'clock. Well, it's a little bit after 9, and I think we'll get started. This is a COVID and well-being session at ISQOLS conference in Burlington, Vermont. I'm Joe Sergi, and I will be chairing that session. I mean, the reason why we essentially perform this exercise is to bring together all the different scholars from different countries and learn from what those countries have done in the context of mitigating the economic effects of the pandemic, as well as, of course, the public health problems associated with COVID. So what we came up with is these are the mitigation strategies that were used to, essentially mitigate the spread of COVID-19, and then we'll talk about the economic effects. But again, for the sake of time, I'm going to try and be as brief as possible. So as you can see, some of the ones, the mitigation strategies in terms of public health, like social distancing and wearing masks and mask provisioning and lockdowns of communities and businesses, quarantining and self-isolation, testing for infection, immunity diagnostic, and for antibodies, sanitary practices, vaccinations, contact tracing, crowd hotspot mapping, on and on, plasma donation and so forth. So these are the ones that have been used throughout the world, I mean, globally. And we just have to say that they have been very effective to the point where, the economy was equally affected, I mean. And then we have mandates for enforcement and other government actions, from directives to ensure effective implementation of health intervention, accelerated vaccine development and production, financial and logistical support for hospitals and other healthcare organizations, creation and coordination of alliances and initiatives, testing, site funding and staffing, travel restrictions of all sorts, communication campaign support and funding. Again, these are the mandates that were used throughout. So many countries have used those. Then we have, again, to mitigate the spread of COVID-19, we have NGOs participating in big ways, like medical infrastructure and institutions, hospitals, clinics, testing labs, pharmaceutical companies, pharmacies, and so forth. Were involved. We're equally involved to, in essence, distribute the vaccines, and then we have the business community involved. These are organizations reconfiguring workspaces and allowing remote work and implementing public health protocols in service and product delivery and on, traditional social media to provide information. So there's quite an effort on the part of the business community to get involved in helping mitigate the COVID-19. And of course, there are other types of NGOs from communities and neighborhoods and individual citizens doing all they can to, from providing masks and doing all kinds of other things. Again, I'm going to try and skip. Now let's look at the economic and social effects and how government and NGOs try to, again, mitigate the adverse effects of COVID-19, from legislation to provide direct COVID relief payment and financial payment to at-risk populations. We've seen that in many countries. Tax regulations and obligations adjusted to support needed relief to families and workers. Again, that many countries have done that. Support for home-based small businesses and micro-enterprise startups directives to utility companies to provide free power and water to those in the greatest need due to the loss of livelihoods, guarantees of minimum wage, living wage for vulnerable families, directives to bank and financial institutions to offer loan deferrals, and on, all kinds of programs that were deemed successful that help mitigate the negative effects of COVID-19. So these just are, literally the tip of the iceberg in terms of our learning of what worked and what didn't work. And of course, from the NGOs, we have quite a bit of strategies that help too, from organizational philanthropy, like business community programs and outreach and support. Trade associations got involved, unions, financial and emotional support programs for members and non-members. Religious organizations and faith-based groups also were equally involved. Outreach to communities via churches, mosques, and temples. Neighborhood coalitions and individuals, we had civic duties in neighborhoods across all countries to assist with financial, mental, and emotional well-being. So these are the strategies that we learned from what was implemented by these 28 countries, from the scholars that participated in this exercise. I know that I am over. I ran out of time. One of the things that we also learned are these, under what conditions certain kinds of strategies, whether they are related to public health or to mitigate the economic externalities associated with those mandates, we learned a whole lot about what those moderate, under what conditions, what strategies were more effective than others. So we were able to come up with literally a list of those moderators and discuss those moderators so that, again, for those of us that are involved in this kind of research, would be able to test those hypotheses. Let me give you an example. Just an example, like age, countries with younger populations were generally more resilient. So again, countries that have younger populations, as many of the African countries, for example, and the Middle East countries were more resilient because they didn't have they had a larger younger population, because if you have a much larger older population, then this is essentially a vulnerable population. So this is what you call a moderator. And we've got some initial data to indicate, to demonstrate that, but these moderators need to be systematically tested in a robust fashion. Okay, well, on that note, let me turn it over to the next presenter. Well, let's see. Do we have any questions? Maybe we can limit it to one question because of time. Questions? Questions from the audience who are participating on Zoom? Okay, we've got one question.
Joe, from all that you've seen from this multi-country study, what's the one insight that really surprised you?
Like, for example, I'm thinking about Sweden. Sweden chose not to institute any kind of public health mandates, and they suffered a great deal. But then, they were going with the notion that there is this the herd, what do they call it? The herd
immunity.
Immunity, that's right. Herd immunity, and if they would be able to achieve that herd immunity, then everybody should be okay. But again, the facts where that there's a high level of mortality in Sweden, and it's good that they have a smaller population compared to others. But the idea of the herd immunity as maybe a panacea to mitigating the effects, the public health effects, as well as the economic effects, did not work. So down with the herd immunity idea. So yeah. Okay.